Most people go to the emergency room to have broken bones set, colds treated, and various other minor issues. But what if you had to go and they found something else? Join us as we have a look at some of the strangest objects that have been abstracted from people. A loaded gun. Dallas Archer from Kingsport, Tennessee was caught driving without having a license in April of 2014, and what should have been a routine search in jail ended up with an unknown item in her crotch. Well, it turned out to be a loaded 4-inch North American Arms mini revolver. The gun itself had been reported stolen from a vehicle which was owned by John Souther of Kingsport. Dallas had her gun stashed in the most unusual of hiding spots and ended up getting her charges for bringing contraband into a penal facility. She would then also be charged with marijuana possession, driving without a license or proof of insurance, and failure to appear and vandalism. She then made a plea agreement to spend 3 years in jail for her game of hide and seek and do 3 years of community service, along with 2 years of probation and a fine of $1,000. An entire cutlery set. Margaret Daalman from the Netherlands got admitted into a hospital for reported searing stomach pains. When the hospital did x-rays, doctors were expecting something along the lines of maybe appendicitis or a kidney stone, but what did they get exactly? As it turns out, it was an entire set of forks and spoons, and when they counted it all up, it came to nearly 78 utensils in total. Now, why would someone ever want to eat an entire cutlery set, aside from aiming to get on our list? Doctors theorize the reasoning being PICA, a disorder that is often found in pregnant women, which makes them develop cravings for items that are not food or intended for consumption. Things like dirt and drywall and metal and trash and, kitchen utensils. 30 items. Neil Lansig was just trying to prepare himself for a prison sentence back in February of 2011 when he was prosecuted and jailed for possession charge in Sarasota, Florida. He must have known that he was going to be facing some jail time because the 34-year-old packed for his journey. During a routine search, jailers observed that part of a condom was sticking out of Neil's anus, and in that condom, well, there were 17 round blue pills. Pills which were later found to be oxycodone, 1 cigarette, 1 flint, 6 matches, an empty syringe with an eraser over the needle, a lip balm container, a CVS receipt, a condom, and a paper coupon. A Wendy's plastic fork. John Manley took his love of fast food to a whole new level. He reportedly suffered from long, various lung issues which included pneumonia, along with fits of coughing and turning blue to the point of fainting. Now, instead of going to see someone for emergency treatment, he ignored the problem, hoping that it would simply go away on its own. After fainting numerous times in public, he finally decided to go and seek treatment. Doctors who saw him initially thought that he simply had a tumor on his lung. However, it was not a tumor at all, but a piece of a Wendy's fork that he had inhaled while eating at the chain. Hopefully, Mr. Manley decides to slow down the next time he's enjoying his meal. A cell phone. An Australian jail received quite the surprise in February of 2016. Con Giorgio, a convicted triple murderer, was on strike and in Goulburn Jail in the Supermax portion. That part of the jail is where the worst criminals are kept, and it's supposed to be one of the most secure jails in all of New South Wales. However, there is a strict policy in the jail about banning mobile phones, and penalties are imposed on inmates who are found with the contraband. Giorgio was subject to a metal detector test, which found an object inside of him. He was left to be observed until Mother Nature simply ran its course and the object came out. However, he was trying to avoid such a thing from happening. The object, a cell phone, was finally passed from his rectum after a staggering 12-day standoff. A spokesman from the prison confirmed the outcome was the result of a normal procedure that they used in situations that were similar. We have no doubt that he's relieved to have the phone out of his body, and the jail was relieved to remove the phone from their prison. A knife. Li Fuyan had been robbed, and during that robbery attempted to stop his assailant and was stabbed through his throat during the scuffle. Afterwards, he would report that the robber had taken the knife with him and had little complaints. Li would suffer from some bleeding in his throat and a problem now and then with swallowing. He suffered through the discomfort for 4 years, finally relenting in 2011 and going to the hospital. That's when Li would tell doctors that he had been robbed 4 years prior and that he had been stabbed in his lower right jaw. Along with that, the blade must have broken off without him realizing it, because surgeons worked carefully to remove a blade without shattering it. And the knife, now rusty, was sitting behind his throat, narrowly missing his carotid artery and other crucial structures. A pea plant. In 2010, Ron Svaden from Massachusetts was rushed to the emergency room with what professionals thought was a collapsed lung. He showed symptoms like a shortness of breath, a cough, and other complaints that are often associated with emphysema. Once admitted, doctors frantically tried to find what was causing what they believed to be a collapsed lung and ruled out cancer. However, x-rays that were done on him showed quite an unusual growth. The growth was in his lung, but it turned out to be a 1-centimeter pea plant. As it turns out, just a few months earlier, he would be eating some vegetables. And that's when a pea went down the wrong way, entering the trachea and not the esophagus. Once it landed in his lung, it split and then began to grow. As it turns out, the human lung, with its warm and moist environment, is ideal for a pea plant to flourish. A nail in the brain. Dante Atullo from Chicago was working on building a shed in January of 2012 when the nail gun that he was using misfired. The nail would end up striking him in the head, but he and his fiancée believed that it was simply just a superficial wound. Atullo tended to his injury and then returned to building the shed. The next day, he was feeling rather unwell, and his fiancée at the time, Gail Glanzer, had finally convinced him to go to the emergency room. That's where doctors would perform an x-ray which helped to identify that his feeling under the weather was actually a 3.5-inch nail that had lodged in his brain. At the hospital, neurosurgeons, during a 2-hour surgery, would drill 2 holes into his skull, removing the nail and some bone. Doctors say that the nail came only millimeters from the part of his brain that controls his movement, and miraculously, he suffered no lasting symptoms. A bomb. In 2006, Private Channing Moss went on a mission in Afghanistan's PICA province. His company was going through a series of dried-out riverbeds, and that's when Taliban fighters would open fire. They were firing rocket-propelled grenades when Private Moss was pushed into his Humvee. He would later discover that when he looked down, the tail fin of an RPG was protruding from his stomach. The company medic helped to treat his wound with great danger to himself. The medic managed to stabilize the RPG and then attempted to help Moss remain calm. When the med evac team came, they were not supposed to transport Moss because of the explosive device that he had lodged inside of him, but they decided to take the risk anyway and took him to a base that had a makeshift hospital. The fins on the RPG were removed first, and then they delicately worked to extract the rocket. Once removed, one of their explosives experts managed to detonate it, while surgeons finished repairing Moss. After 4 more surgeries and a multitude of physical therapy, Private Moss was fortunate enough to walk again. 421 coins and bolts. In November of 2011, Kalishwar Singh went to the hospital for severe pain. There, Dr. Yadav, who was the attending physician, felt that the amount of pain that Mr. Singh was in warranted immediate surgical intervention. Upon an examination, it was discovered that there was a serious blockage in Mr. Singh's stomach, which was found during a sonography exam. He found 421 coins and dozens of nuts and bolts. Mr. Singh was very fortunate to survive his blockage and was reportedly suffering with the pain for a time frame of about 3 months. During that time span, he would attend several doctors in the village, but the issue that he was having was not detectable. When questioned as to why he would put the strange objects into his body that nearly cost him his life, his family members could only speculate that he suffered from mania and that he had the habit of finding random objects and eating them. A giant hairball. Though her identity remains unknown, it would be in 2007 that an 18-year-old woman went to the Rush University Medical Center located in Chicago with what was reported as severe stomach pains, a loss of 40 pounds, and vomiting. That extreme amount of weight loss is highly unusual, and of course, it had doctors worried. They would perform an X-ray and then find what was described as a large dark mass. When they finally operated, they just assumed that it was a tumor, but what they got instead is known as trichophagia, meaning that she eats her hair. And based on the hairball that was found, she does it quite frequently. The next time that you think about chewing on your hair while doing something, just remember, you could end up in the emergency room. A foot-long surgical tool. After having an operation, a man started to experience severe pain. After 2 years without any kind of recovery, he was repeatedly told that nothing was wrong with him and even advised to go and get psychiatric treatment. Finally, after a long history of complaints, doctors would do a CT scan. After performing a surgery, they found a set of retractors that had been left inside of him during his last surgery. And what is a retractor, you ask? Well, it's a large set of tweezers that are nearly 10 inches long, and nobody noticed them while sewing him up. The optokinetic drum. The name may sound confusing, but its use is actually rather simple. More likely than not, you have even seen a few optokinetic drums in your lifetime, because usually they come in the form of a black and white vertically striped spinning cylinder, and they're often used in fun houses to cause visual disorientation while you're on the tour. The original use of the optokinetic drum was to test a person's